to TV5 News at 9. It is time for our Aging in Style segment. Joining me this morning is cardiologist Dr. Masri with McLaren. Thank you so much for joining me.
Thank you for having me. Good morning.
Good morning. We are talking about a huge topic, and it's on a lot of people's minds out there. Tell us what heart failure is, the difference between heart attack and heart failure.
So a heart attack and heart failure are about in the same category,
okay.
You can say. Heart attack usually happens because one of the main arteries of the heart gets blocked, and then you lose blood flow. Just, in common terms, just blood flow to that part of the heart muscle. And then eventually that part of the heart muscle dies. And usually it's caused because of plaque formation. We say just a cholesterol buildup. Heart failure kind of falls into that category too, because one of the most common causes of heart failure in this country is because of heart attack. What happens is the heart muscle gets weakened, and it loses that capability of the pump to be efficient, to pump adequately, and people start developing symptoms of fluid collections and all that.
Okay, so tell us a little bit, what are the signs and symptoms of heart failure?
So with heart failure, I mean, there's different types of heart failure. The one that we see the most is the one because people have, such as what we say, ischemic cardiomyopathy or dilated cardiomyopathy, basically just the inefficiency of the pump, of the heart muscle pump to be efficiently.
It's not pumping properly.
Not pumping properly.
Okay.
So a lot of the symptoms are, some of it not specific. It starts out usually with just limitation of activity. A lot of these patients notice that they're pacing themselves a lot slower, not breathing so efficiently.
Oh, so you feel out of breath?
Yeah, feel out of breath. A lot of the other conditions can make you feel out of breath, but in heart failure in general, it just, they feel like they're pacing themselves slower, become more short of breath over time, and as it becomes more profound, they have the symptoms of orthopnea, which is the inability to lay down flat at night. A lot of them feel like they lay down, they have to get up in the middle of the night to breathe.
Okay.
And then their legs starts to swell up. They feel like their abdominal girth increases and all that.
Now, are there some treatments? What are the treatment options for people suffering from heart failure?
So a lot of the treatment options, I mean, for the predominant part is medication. So there's a lot of good medication out there that we actually, so for heart failure conditions such as the ones with the weak heart muscle, dilated cardiomyopathy, different medications that actually help reverse, what we call reverse remodeling, meaning that, change the heart to get the heart to shrink and to pump more efficiently.
Okay.
But, along with that, there's, diet, exercise, stop smoking, a lot of lifestyle changes. We use diuretics a lot to kind of counteract that congestion.
Okay. And now, does every cardiologist provide a heart failure clinic?
No, unfortunately not.
No.
So we have ours at McLaren, McLaren Bay.
Tell us about it.
It's an advanced heart failure clinic, and we have a group of cardiologists. I am the one that directs it mainly.
Okay.
We have a whole staff, our nurses, my nurse practitioner, Sue Hafer, that works with me. So we kind of try to coordinate a close follow-up with these patients, because it's for heart failure it's not the general thing that you have to do. It takes a lot more attention to take care of this patient. You have to see them more frequently, more often. Your goal is to prevent them from ending up in the hospital and to make sure that they take their medication so they can live a better life.
So there's a lot of maintenance involved. Now,
a lot of maintenance involved.
When is it time to consider a transplant for these patients?
So a lot of these, it's kind of a chronic condition. So it gets to a point where, despite all the medications you give them, despite different options, we have, so we talk about optimal therapy, meaning that we get them on all the right medications. There's different pacemakers to actually, help them kind of synchronize the heart to get the heart to shrink to improve their heart failure. There's, surgeries, valve surgeries, arrhythmia treatments. There's even what we call left ventricular assist devices. But, machines to kind of help the heart pump.
So is transplant the last resort?
Transplant is kind of your last resort.
Okay.
Yeah,
okay.
So when these patients, progressively coming in, despite everything that you're doing, they're getting worse and worse. Then we start evaluating them for that as an alternative.
Tell us what else that we haven't talked about that's important to know about heart attack, heart failure. You said a lot about maintenance. That's important. What else do we need to consider that we didn't talk about? Anything?
For heart attacks, a lot of it is lifestyle changes, for sure. I mean, you have to take into consideration your risk factors.
Okay.
You know, smoking, obesity, family history, high blood pressure, uncontrolled diabetes. So these are all risks that you have to take into consideration to kind of modify, because a lot of that is, those are the risks you have that ends up giving you a heart attack, and from that heart attack you end up with heart failure. So a lot of it is recognizing those changes early, maybe changing that so you don't get to this point that we're talking about.
Start early.
Exactly.
With that. I love that. Lifestyle changes early. Thank you, Doctor, for joining us. Appreciate that.
Thank you for having me.
You're welcome. And for more information, head to the Hot Link section and the Aging and Style tab on WNEM.com.